Hi, good morning, Campbell. My name is Mahira. I'm your invigilator for the OIT speaking session on the 29th of April 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Campbell Cole.
And what is your candidate number?
My candidate number is 272033978.
Thank you. Are you taking this test as a nurse?
Yes, I am.
All right. Can I see your ID, please?
Sure. Here it is.
All right. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Explain a difficult situation you handled.
I had an encounter with an elderly patient who was yelling loudly because the doctor had refused to increase her pain medication. I calmly listened, told her I was sorry about her discomfort, and asked if there was anything I could do to help. She started crying and told me that she was more upset about her family not calling to check on her. I encouraged her to reach out to them, which she did, and it turned out they were not even aware of her hospitalizations.
Do you find that communication skills are important for a nurse?
Communication and interpersonal skills are of the utmost importance. Nurses must communicate effectively with senior medical personnel, patients, and the staff. But they must especially be good at communicating with the patient's bystander or family.
Talk about a time you worked in a fast-paced setting. How do you prioritize tasks while maintaining excellent patient care?
Working in an ICU setting is extremely fast-paced, and it is essential to prioritize your tasks for the day. At the beginning of the shift, I make a to-do list with everything that needs to be accomplished. I put the must-do things at the top of the list, and the things I would like to do at the bottom. Administering medications are placed at the top of the list, and washing a patient's hair is further down. While I would love to accomplish everything, it just isn't possible.
Tell me about a time you stepped into a leadership role.
I have acted as a charge nurse numerous times in my career. I have had to lead code teams, respond to rapid responses, and make difficult staffing decisions. As a charge nurse, I have determined patient assignments to ensure that assignments are fair and equal. Furthermore, I have to ensure that the nurse's skill set is sufficient for the assignment.
Tell me about a time you were under a lot of pressure, and how did you get through it?
I was the most senior nurse in the unit for over a decade. I had to not only handle my patient assignment, but also was to act as a resource to the other newer nurses on the unit. I had to make sure my time management was great, as well as my ability to drop everything and help someone else. I had to stay organized, otherwise, I would not have been able to assist others.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role plays to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mahira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mahira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. I'm Campbell Cole, one of the nurses here in the emergency department. How may I help you today?
Nurse, I was bitten by a snake 15 minutes ago. I need immediate care.
Don't panic. We are here to help you. Please tell me your full name and age for the records.
My name is Mahira, and I am 40 years old.
Mahira, if you don't mind, can I ask you a few questions to get some basic details of the accident, please?
Sure, you may ask.
Thank you, Mahira. First of all, could you please tell me in detail about the snake bite?
Yes, sure. I was watering plants in the garden. Suddenly, I felt something sting on my right leg. But what I found was a snake crawling into the bushes.
All right. How severe is your pain?
Pain is quite manageable. It's a mild pain.
Would you be able to describe the snake?
Yes, it's a brown snake, which was around a meter long. It was the usual one we often see. I do not have a photograph of it, but I can identify it.
Okay, is there anything else to be added to the details?
No. That's all.
All right. May I know your symptoms after the snake bite?
After the accident, I got frightened. So, I feel anxious and sweaty.
Mahira, it's natural to feel anxious in these situations. Try to be calm. Seeking medical attention is the right action, and you did that. Be optimistic. Nothing will happen wrong.
Okay, nurse.
How about your breath?
I can breathe without any difficulty.
That sounds good. And what about your vision?
I don't have any issues. I can see clearly.
All right. Well, Mahira, let me briefly explain what I have understood about your condition.
Okay, nurse.
You were here after being bitten by a snake. It happened 15 minutes before the reporting time, while watering plants in the garden. You felt something stung on your right leg and found a snake crawling into the bushes.
Yes.
All right. You have mild pain, which is quite manageable. And describe the snake as the usual one we often see, which is brown in color and around a meter long.
Yes, nurse.
Okay. You feel anxious and sweaty. But you neither have any breathing difficulty nor blurred vision.
Yes, nurse.
For confirmation, am I correct, Mahira?
Yes, the details are correct.
Thank you for the confirmation. On the initial assessment, you seem to be normal. As of now, there are no complications. The snake might be non-poisonous, therefore, normal wound treatment is what you just require. However, you need to be conscious about any changes you may have.
But nurse, I think I need to see the doctor and get a definitive treatment.
Mahira, your thoughts are understandable. Let me explain when to see the doctor.
Okay.
Since you do not have any signs of complications, I suspect the snake to be non-poisonous. Kindly observe the area for any signs of swelling. If you feel any breathing difficulty, blurred vision, or worsening pain, then you must see the doctor and seek medical attention.
Okay, nurse. I got it.
I reassure you that about 70% of all snake bites are from non-venomous species. So, don't worry. Everything will be all right. Perhaps you need to check for some signs of changes.
Sure, nurse. I will.
Mahira, do you have any other concerns?
No, nurse. It's fine.
All right. Mahira, always feel free to contact us for further queries. I wish you a speedy recovery.
Of course. Thank you. That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.